In this video, we'll discuss about carcinoma of gallbladder. It is a rare but it is most common malignancy of extrahepatic biliary tract. So, what is carcinoma of gallbladder? It is a rare but most common malignancy of extrahepatic biliary tract. Carcinoma of gallbladder is more common in females. This one is more common in female than in male. It occur in the people of age 60 to 70 years. So this one is the most common malignancy of extrahepatic biliary tract, most common in male and female, and comparing to male, this one occur in the people of age group 60 to 70 years. Coming to etiology, first is the risk factor. The risk factor of gallbladder carcinoma include, first one is gallstone. The gallstone which predispose to the gallbladder carcinoma. This gallstone which predispose to the gallbladder carcinoma, they cause chronic irritation, chronic inflammation, epithelial damage, which predisposes to gallbladder carcinoma. They causes chronic irritation, chronic inflammation and epithelial damage, which predisposes to gallbladder carcinoma. Next risk factor is genetic factor. Second one is genetic factor due to which the gallbladder carcinoma is more prevalent certain part of country. This gallbladder carcinoma is more prevalent in some part of countries. Next one is carcinogen present in bile acid. Next one is carcinogen presented in bile acid. Then the calcification of gallbladder. Then GI, GI tract disorders like ulcerative colitis and polyposis syndrome. In GI tract disorder like ulcerative colitis and polyposis syndrome, these all are risk factor of gallbladder carcinoma. Gallstone, genetic factor, carcinogen presented in bile acid, calcification of gallbladder, then GI tract disorder. Next is molecular genetics. Molecular genetics which include KRAS mutation, then P53 mutation, which is tumor suppressor gene, then mutation in DNA repair gene. All these can causes gallbladder carcinoma. So molecular genetics, KRAS mutation, then P53 mutation, this one is the tumor suppressor gene, then mutation in DNA repair gene. Coming to morphology, first crossly, gallbladder carcinoma occur mostly in fundus and neck of the gallbladder followed by the body. First crossly, this gallbladder carcinoma occur mostly in fundus and neck of the gallbladder followed by the body, and it is usually shows this calculi, and there are two type of growth pattern of carcinoma, two growth pattern of carcinoma. It can either diffusely infiltrating, which account of 70%. First one is diffusely infiltrating, which account of 70%, that is more common type. Other pattern exophytic or polyploid pattern. Exophytic or polyploid pattern accounting for 30%. So first, that diffusely infiltrating type involved poorly defined area of diffuse thickening of gallbladder wall. Poorly defined area of diffuse thickening of gallbladder wall. There is predominant desmoplasia. In case of diffusely infiltrating gallbladder carcinoma, and this is sclerosis, gray white, very fine consistency. So this one is criticize, gray white, very fine consistency. Next, this one exophytic or polyploid pattern. It grows in lumen as irregular. It grows in lumen as irregular. Cauliflower mass invade the underlining wall. Invade that underlining wall. Next, luminal portion shows area of necrosis. Luminal portion shows area of necrosis, hemorrhage and ulceration. This is all about grass. Two pattern of growth, diffusely infiltrating exophytic or polyploid. Next, microscopy. In microscopy, mostly gallbladder carcinoma, adenocarcinoma variety. It comes under adenocarcinoma, showing varying degrees of differentiation. This one shows varying degrees of differentiation. Well differentiated carcinoma have well formed gland which are lined by layer of cuboidal cell, layer of cuboidal cells embedded in desmoplastic stroma. Well differentiated carcinoma have well formed glands which are lined by layer of cuboidal cells embedded in desmoplastic stroma, whereas other tumors are infiltrative and poorly differentiated to undifferentiated. Poorly differentiated to undifferentiated. It is microscopy of gallbladder carcinoma. Next, spread. There are three ways of spread: direct, lymphatic and hematogenous or blood spread. So first one is direct spread. So that spread of gallbladder carcinoma can be either direct or lymphatic or hematogenous. That means blood spread. So first one is direct spread to the liver, peritoneal surface, cystic duct, adjacent bile duct. Second one is lymphatic spread, perihillar and portal hepatic lymphoid. Perihillar or lymphatic portal hepatic lymph nodes. In later stage, mediastinal lymph node and supraclavicular lymph node. Later stage, mediastinal lymph node and supraclavicular lymph node. Blood spread through liver and lungs. That hematogenous or blood spread is to liver and lungs. In case of liver, both local and hematogenous spread. Lastly, clinical features of gallbladder carcinoma include pain in right upper quadrant, pain in right upper quadrant, anorexia, nausea, and vomiting. Finally, lab test increased alkaline phosphatase level. So, clinical features of gallbladder carcinoma include pain in right upper quadrant, anorexia, nausea, and vomiting. Lab test when increased level of alkaline phosphatase enzyme level indicate gallbladder carcinoma. So, this is all about gallbladder carcinoma. Thanks for watching.